My name is Harvey, and my topic is on breast cancer. Here I have a diagram of a breast that contains a piece of breast cancer attached to the tissue inside the breast. Breast cancer is one of the most common malignancies for women, which accounts for 30% of all female malignancies. The formation of breast cancer stem cells is attributed to the acquisition of stemness of tumor cells. Brain cancer can happen to anyone, and what the chemo was just to happen to be in your life or in your family, you'd want to know everything that was going on. There are a lot of things to know about breast cancer, such as the most common types, the least common types, and how to cure it. First, I will discuss what about breast cancer is and the most common types of breast cancer. Second, I will discuss the least common types, and finally, I will discuss how to cure it. Breast cancer is a disease in which the cells in the breast grow out of control. There are different kinds of breast cancer. The kind of breast cancer depends on which cells in the breast turn into cancer. The most common are invasive ductal carcinoma, invasive lobular carcinoma, and ductal carcinoma in situ. Invasive ductal carcinoma, or IDC, sometimes called infiltrating ductal carcinoma, is the most common type of breast cancer. About 80% of all breast cancers are invasive ductal carcinomas. Invasive means that the cancer has invaded or spread the surrounding breast tissues. Ductal means that the cancer began in the milk ducts, which are the pipes that carry milk from the milk-producing lobules to the nipples. Carcinoma refers to any cancer that begins in the skin or other tissues that convert internal organs, such as breast tissue. Altogether, invasive ductal carcinoma refers to cancer that has broken through the wall of the milk duct and begun to invade the tissues of the breast. Over time, invasive ductal carcinoma can spread to the lymph nodes and possibly to other areas of the body. Invasive lobular carcinoma is the second most common type. Invasive lobular carcinoma refers to the cancer that has broken through the wall of the lobule and began to invade the tissues of the breast. Over time, invasive lobular carcinoma can spread to the lymph nodes and possibly over other areas of the body. According to American Cancer Society, more than 180,000 women in the United States find out that they have invasive breast cancer each year. About 10% of all invasive breast cancer are invasive lobular carcinoma. ILC tends to occur later in life than invasive ductal carcinoma, the early 60s as opposed to the mid to late 50s. Now that I've discussed the most common types of breast cancer, I'll move forward to the least common types of breast cancer. The least common types are Paget's disease, medullary, mucinous, and inflammatory breast cancer. I'll first discuss Paget's disease. Paget's disease of the breast is a rare type of cancer involving the skin of the nipple and usually the darker circle of the skin around it, which is called the areola. Most people with Paget's disease of the breast also have one or more tumors inside the same breast. These breast tumors are either ductal carcinoma in situ or invasive breast cancer. The next least common type is medullary carcinoma. Medullary carcinoma of the breast is a rare subtype of invasive ductal carcinoma, accounting for about 3 to 5% of all cases of breast cancer. It is called the medullary carcinoma because the tumor is soft, fleshy mass that resembles part of the brain called the medulla. Medullary carcinoma can occur at any age, but is most common between the ages of late 40s and early 50s. Medullary carcinoma is more common in women who have a BRCA mutation. Studies have shown that medullary carcinoma is also more common in Japan than the United States. The next least common type of breast cancer is mucinous carcinoma. Mucinous carcinoma is a rare form of invasive ductal carcinoma. In this type of cancer, the tumor is made of abnormal cells that float in the pools of mucin, a key ingredient in the slimy, slippery substance known as mucus. In mucus carcinoma, mucus becomes part of the tumor and surrounds the breast cancer cells. The final least type of breast cancer is inflammatory breast cancer. Inflammatory breast cancer is a rare, aggressive form of breast cancer. According to the American Cancer Society, about 1% of all breast cancer cases in the United States are inflammatory breast cancer. Inflammatory breast cancer usually starts with a reddening and swelling of the breast instead of a distinct lump. IBC tends to grow and spread quickly with symptoms worsening with days or even hours. Now that I've discussed the least common types of breast cancer, I'll inform you how to cure breast cancer. I'll discuss three ways how to cure it. One way to get rid of breast cancer is to go through surgery. Lumpectomy, also known as breast-conserving surgery, is the removal of only the tumor and a small amount of surrounding tissue. Mastectomy is the removal of all the breast tissue. It is more refined and less intrusive, and then is to be used because in most cases the muscles under the breast are no longer removed. Lymph node removal or axillary lymph node dissection can take place during lumpectomy and mastectomy if the biopsy shows that the breast cancer has spread outside the node duct. Some people qualify for the less invasive sentinel lymph node dissection. Another way of curing breast cancer is by going through chemotherapy. Chemotherapy is treating using medicines to weaken and destroy the cancer cells in the body, including cells of the original cancer site and any cancer cells that may have spread to another part of the body. Chemotherapy can use the early stage invasive breast cancer to get rid of any cancer cells that may be left behind after surgery and to reduce the risk of the cancer coming back in advanced stage breast cancer to destroy the damage of the cancer cells as much as possible. Sometimes chemotherapy will be given before surgery to shrink the cancer cells. When chemotherapy is given before surgery, it is called neoadjuvant. Another way to cure breast cancer is through radiation therapy. Radiation therapy is a highly targeted and highly effective way to destroy cancer cells in breast that may stick around after surgery. The radiation treatments will be overseen by a radiation oncologist. There are two ways to deliver the radiation to treat the tissue: a linear accelerator or a pellet material that give off radiation. Despite what many people fear, radiation therapy is relatively easy and to tolerate, and the side effects are limited to just treated area. In conclusion, it is important to know the different forms of breast cancer so that you may prepare, so treatment is better for you, so you'll know someone who is going through breast cancer and what they must go through.